And now at 5, we are going to what the state is calling 2 probable cases of measles in Oklahoma connected to the outbreak in Texas and New Mexico. Glad you're with us. I'm Shay Rozzi.
And I'm Nathan Thompson. We told you last week about a possible measles case in Bartlesville that turned out not to be a confirmed case, but instead the person was positive for immunity to the virus. But the 2 cases announced today, the state has reported those to the CDC as probable measles cases.
New at 5, Fox 23's Jade Morrow is live with what she learned from the state health department and what you should do if you suspect you or your child has the measles.
Well, with these 2 cases in Oklahoma, both individuals involved in these cases confirmed that they were exposed to Texas and New Mexico measles outbreak. The State Department of Health says that the 2 individuals did follow health guidelines and recommendations immediately after being diagnosed and stayed home, isolated themselves during the time they were contagious. The Infectious Disease Prevention and Response is not releasing where the reported cases are to protect the safety of the patient's identity and say there is no risk to the public. As measles is incredibly contagious, Kendra Daughtry with the Infectious Disease Prevention and Response highly recommends people to stop and call their health care provider and not show up at a doctor's office for their own safety and those around you.
We don't want somebody walking into a healthcare clinic and, because when they do, then any infectious virus that they have will just hang out in the air for 2 hours and expose everybody else that walks through that space. So really call ahead if you have questions or concerns about your symptoms to your healthcare provider.
Now, the symptoms that you should look out for are flu-like symptoms, runny nose, cough, red itchy eyes, and with those will linger for 3 days to 5 days. And after 3 to 5 days, you could get a measles rash that appears and disappears in a specific pattern starting at the hairline down to your whole body in a matter of days. Now, it is important to note washing your hands is not a prevention measure for the measles, and the only prevention method is the MMR vaccine. If you'd like to learn more about information about measles, symptoms, treating it, and more, we have links on our website in the story on fox23.com. Live in the studio covering news that matters, I'm Jade Morrow, Fox 23 News.
Infectious Disease Prevention and Response is working with their health partners and communicating with schools, churches, local businesses, and child care facilities to raise awareness and help educate people of what's going on and how to stay safe. The last reported case of measles in the state of Oklahoma was in 2019.